Okay, and then close that, and then I'll give this back to you. Change the role to. Huh. I'm the presenter. Now I'm changing the role to you. Huh. Miguel, why isn't it going back to you?
Let's see. I think I
You
might.
have it. You have it.
I have it? Okay, yes. Okay.
Okay.
Okay. How does that look?
Okay, I see your presentation and I see you.
Okay, that sounds good. So I just wanted to wave and say hi, and that'll probably be the extent of my use of the presenter mode and the video mode. I'm sorry, I'll keep presenter mode, but that'll be the extent of my video mode. So let me turn that off. So hi to everybody. It's good to be back with you all, and thanks for making time in your schedule. I'm opening up the chat window on my screen, and I have the presenter list or the list of attendees. So it's good to see the names of those of you who have joined us. So we're in an interesting time. We were certainly at the start of this interesting time when back in early March when we were all together in different sites across the state. But I wanted to just start by maybe just taking a minute because I don't want to dive into this like we're just going to dive into learning without recognition of the situation that we're all kind of in. I know that there's an urgency to the moment of what we're all trying to do with our libraries, with our families, with our communities, and other things. So if you haven't had a moment to just kind of take a minute and recognize that we are kind of operating in a new and different space and that it isn't normal and that it's kind of hard on all of us. And let's just take that as sort of our opportunity to think a little bit deeper about what we're trying to do and maybe not to put so much pressure on all of us and to recognize the difficulty that kind of everyone's going through. With that kind of said, I want to just talk a little bit about what I'm hoping to do with the hour. I wanted to spend a little bit of time going back to where we were during the workshops in Alaska. And so we'll kind of refresh our minds about reviews of futuring. And then I wanted to spend a little bit of time asking how you all are doing with a certain amount of freedom because I know this hasn't been the most ideal or opportune time to launch into some of the work and activities that we had talked through. And then I wanted to talk a little bit about some of the trends and changes that are happening now, some of those topics that we talked about then and where they might fit into the world or how we might want to start thinking about them in new and different ways. And then maybe we'll just take a quick minute or so to wrap up and think about what might be next. So for the review of the futuring, I mean, we talked about lots of the different tools and tips for thinking about the future, but I'm just going to go back to Jane McGonigal, who's kind of been talking, who kind of framed thinking about the future as 4 steps. She said we have to collect signals from the future. In a moment like right now, I think we're overwhelmed by many of those signals. It's kind of an abundance of those signals. We want to start to combine signals into foresight, into forecasts. And I think we have a lot of opportunities now to think about, especially as most everyone in our community is not only responding to the current needs, but also starting to figure out, well, when will things get back to normal? What steps have to take place? And what will kind of reassemble to create some of those forecasts? In that moment, we also have to create personal foresight and ask ourselves, well, what would happen in our libraries or in our communities? And then we also have a certain amount of opportunity to play with the future. I think one of the things that we're starting to experience in this moment is that it won't necessarily be that sort of fantasy play with the future. I think some of us are going to have to quickly switch modes and ask ourselves how we will accommodate policies or procedures, the new normal that will start to emerge. And we'll talk a little bit about some of that when we get to some of the trends and changes that are happening now. With those things in mind, I kind of just wanted to walk through and maybe we can unmute people as we have opportunities to talk, or maybe you can chat ideas into this. Um, uh, talk about how we're working and using some of the things that we learned about, but also because we're in the moment that we're in, maybe we're not doing anything right now with this type of futuring stuff. But maybe we can talk about some of the things we're planning on doing when we reconnect with our colleagues and our networks across the state and get back into the workplace. So I wanted to ask all of you to think about maybe what are you doing by yourself, maybe with colleagues from your own organization, or maybe with collaborators from across the state, the region, or maybe across some of your other professional networks. Have you started to think or act or started to plan about how you'll engage in things like scanning, in making those connections, strategies for tracking, maybe strategies for forecasting? Um, how are you kind of working through some of those, or maybe what questions or challenges might you have? Um, I don't know how we'll operate this, Julie. Do you have a best strategy? Can we unmute everybody, or should we just let people kind of raise their hands? Or
I think it's best if we have most people, unless you're talking to keep yourself muted, because otherwise we get a lot of feedback on WebEx. But definitely people can unmute themselves and share. And I'm not familiar with is there a raised hand option?
yeah, I don't think there's a
don't
raise
see
hand
that.
option. But
Yeah, I
we can
don't see
also,
that.
if you'd rather just chat some comments into the chat window, I have that open as well, and we can talk through some of those things. And thanks to Deborah for commenting on how you can raise your hand. Um, okay, I think Robin has her hand raised, maybe? Hi, Robin.
Hi, Robin. Hi. Hi. Can you hear me?
Yes, we can.
Yes, we can. I wasn't sure. The symbols at the bottom of the screen are a little questionable here. Well, I have to say that when it comes for scanning for patterns, I think that this COVID-19 thing has taken up all of the space in the room.
Sure.
And what I'm asking myself is um, what is this telling me about, what is this new pattern of use that we now have to fall into, telling me about my library, for example, and also, pointing out, where are the holes in the services from the state and, nationally. Um, for immediately, the first thing that comes to my mind is that we really need to up our scanning game if we ever get back into the office here. And just so things are available to us long distance, not and to the patrons as well. Um, this is also pointing out the difficulties of connecting, especially here in Alaska. And I think that we really need to see something along the lines of the rural electrification uh, program of the 1930s to make sure that everyone has a solid broadband connection. I'm going to go ahead and close now.
So I think those are some great observations. I want to say one of the things that I'm noticing in this time is sometimes we scan for answers. I think right now, you phrased it so well, where really this is just taking up all of the space, all of our bandwidth. I think that it's also fully appropriate to scan for questions, to scan and ask, well, there's something that's happening out here, and I don't quite know what the answer will be, but let me tag that so I remember what my question is. Because I think that's a lot of this process. And through this time, I've spent some time listening to different foresight webinars and other tools, and a lot of them are talking about that. They're saying you can use this opportunity not to put the pressure on yourself to ask for answers, but use this as an opportunity to seek questions, things that in the future we will need to work with our colleagues to address. I think the other thing that you're pointing out is that One of the things that's become very apparent in this process, and we can see it in the scanning, is that certain things that had been said would be impossible are suddenly more possible. We've seen greater availability from telecommunications companies and other organizations expanding access to different users in different ways. But it also highlights areas where perhaps we will need to double down on the advocacy and use this as an advocacy opportunity to say, you know, in times like this demonstrates why broadband should be a universal right, why access to the internet needs to be something that every American has. All of those are really great observations to have, and to keep this in mind, that we are also collecting information so that we can continue to advocate and push certain issues. Um, and then you followed that up with a chat, you know, how can we as communities and as state increase our ability to manufacture necessary goods? I think that's another big thing that's going to start happening, is that many communities have invested, cities, towns, states, regions have made major investments in single areas of an economy, and those have become incredibly challenged. There's a lot of strain in many of those communities because of their dependence on one particular area of uh, the the um, the supply chain, and that's a really big challenge and problem for those communities now as they're looking to bounce back. So I think your observation, you know, how do we increase our ability to manufacture necessary goods, even if those come with increased costs for other types of things? We're going to start seeing that shift, and we're already recognizing the great value of factory workers. Of course, there's a great emphasis on the value of frontline workers, but I think a lot of it is also the value of factory workers, manufacturing, other types of things. Those are really big. Any other thoughts on how you're getting through some of these areas? Okay. So I understand that this is a really difficult time to start to think about these futuring techniques. So I'm going to kind of put this on hold, and we'll move into maybe some of those other trends, because I see some of the chat starting to shift into those areas of drones and other types of issues. And I wanted to spend a little bit of time talking about that because we opened those doors in the last presentation when we were together on site for some of the workshops. So thinking in the current context, I think it's really important. There's lots of indicators and signs that this moment that we're in is not magically just going to reset and we're all going to reconvene and come back together in our workplaces. That instead, there's probably going to be some amount of challenge in how we come back to normal operations. There was a US government report that talked about preparing for a pandemic that could last 18 months or longer and could include multiple waves of illness. And implied with that multiple waves of illness is that there would be multiple waves of sort of stay-at-home orders and then a returns to normal operations. A really interesting report from Imperial College London proposed such on and off social distancing measures as a viable path to managing the pandemic as researchers and health workers seek a vaccine or as communities start to achieve herd immunity. Their pattern even started to suggest that for some communities, not for all communities, but for some communities, it could be something akin to 2 on, 1 off. Or I'm sorry, 2 off, 1 on. So for every amount of time that we reconvened and reestablished normal operations, there could be a period of time that's almost double that we're back into these sort of interspersed stay-at-home orders, perhaps regionally, likely not at a national scale like we are right now, but that this would become something of a new normal for the next 18 months or so. We're A lot of public health officials are anticipating that during summer months, that the virus may not be as prone to spread, but there's really not enough evidence to kind of start to talk about that. And many different communities are already starting to put limits on what would normally be summertime activities, festivals, neighborhood celebrations, or other types of things. Here in Chicago, a lot of our neighborhood festivals and street fairs have already been told that they're not going to go through this. And then the last thing is that the American Enterprise Institute's National Coronavirus Response Plan talked about sort of 4 key accomplishments that have to happen in order for us to start to move into reopening services. And those will vary community and region by region. A sustained reduction in cases for at least 14 days, increased evidence of hospitals' capacity to safely treat all patients requiring hospitalization without resorting to crisis standards of care, the ability for testing of all people with COVID-19 symptoms, and the ability to conduct active monitoring of confirmed cases and their contacts. And so for each community or region that could vary, but it's a really interesting way to look at different reports and start to think about, well, how long will you have to plan not only for the current stay-at-home order, but also how long would you have to plan for this sort of intermittent staging that it'll move back and forth. So you'll remember that we talked a little bit about some of these different trends and changes, and certainly at the time it had a different flavor to it, I think, but we talked about different things that now have new implications based on communities' responses to the current coronavirus pandemic. So we talked about access and service, and we talked about how libraries are making it sometimes easier or more personalized for users to come and pick up and retrieve materials. And so we talked about these smart lockers and things like artificial intelligence, the book bot, and even the subscription boxes that certain libraries are using. And I think right now what we're starting to ask is, how will library pickup or delivery services experience an increase in demand? We're starting to notice that some libraries are investing a lot of their time in sort of curbside delivery of materials for different things. But I think there's a certain question mark here, because I think for a certain amount of time, even after we have the relaxing of stay-at-home orders, there's going to be a lot of question about interaction with surfaces, including different materials like books, maybe even our DVDs or other types of things that people use. And so even if we shift to easier modes of access, we should also anticipate this idea that people may be reluctant to use the physical collection in a lot of ways. There just might not be that much interest. But we are seeing a lot of indicators. Starship Technologies, one of the big makers of these 6-wheeled robots, they've started to launch their service into lots of different communities for food delivery and materials delivery and other things. A lot of people are starting to show interest in this sort of contactless delivery, but there's also this tension of ethics of, well, should we involve humans, delivery workers, in the contactless delivery? Or are there options that we could use things like this sort of book bot? And even when we start to move back to communities kind of coming back to normal, I think it's going to be really important to recognize that certain people will carry through their behaviors from this experience into the next phase of how our world evolves. So even though all reports may say that it's safe to, visit different places or to shop or do anything, a lot of people, whether it's because of convenience or continued concern, will say, what I would really like is to do these types of things. And so starting to figure out, maybe it doesn't have to be the smart solution, like a smart locker or this particular book delivery, but maybe they're going to want quick serve kiosks or a quick serve shelf where people can easily retrieve some of their materials and just pick them up. So that's something that we'll need to think about. Well, are we prepared with staffing models that might allow fewer staff perhaps to operate in regular times? And maybe there's a staff or a shift that comes in overnight and prepares materials for self-service pickup or something else when people come back. Or do we have a policy in place? I'll tell you, here in Illinois, there's a big concern around the regulation of reserves on shelves. There is concern about whether people's names can be listed on unattended shelving for certain reserves. And that's been a point of concern around the policies and procedures for Illinois libraries. And again, if this self-service model continues, that could continue to be a concern. talked a lot about collections and the shift of collections towards more digital content, and certainly over these past couple of weeks, we've started to see increased interest and use of digital collections because of their availability. I think one of the things that's interesting and happening right now perhaps might be that idea of self-creation of collections and the way that that's becoming easier to use. Um, so I think one of the things that we're going to have to ask ourselves is how will libraries continue to promote and provide access to a growing body of on-demand or creator-generated information and content. One of the weird things that's happening right now is that some of the polish and production of the standardized materials that are coming out are shifting. So we're starting to see, the morning shows are broadcast from people's homes. People Skype into their interviews. They do all of these types of things. We're seeing musicians broadcast their music from their home studios or even from their living room or something else. And so I think that this might also shift some of that pretense around the finished materials that are being used. We may start to see libraries provide greater access to creator-generated information. There may be more familiarity and comfort with some of those types of things, that not everything has to come through the broad media channels or something else. And how might that affect libraries' use of things? Might we invest more in community-generated content, community-generated broadcasts, or something else? And does that have effects on the catalog, on what we recommend for users? Maybe wherein we invest collections dollars and other types of things. Could this be a seismic shift that says maybe that concept of self-publishing isn't as suspect as some of our community members had thought? Maybe there's more openness to different types of ideas. At the same time, I think one of the things that's probably going to happen when we come back from all of this is that many publishers, media companies, and other producers of content have delayed their delivery or release dates for a lot of content. They're pushing back those release dates so that they don't have to contend with this unique period. So we may see an onslaught of a lot of front list titles and content that libraries will have to consider. How do we manage budgets when there's this sort of glut of front list content that we're not quite sure how we make it in, how that gets into our collections, and whether it's worth promoting? That's going to be a really big challenge for us. And I think that push for more digital content is going to be really big as well. And again, this is one of those new normals as well. Like, a lot of the publishers have made some of their digital content cheaper in this time to make it more available to users and community members quickly. How will that change things going forward? And even on rights and permissions around things, how do different things start to shift so that people can reuse and repurpose content quickly to serve an increasingly online audience? We're starting to see those shifts in learning. I think one of the interesting things was that when we presented this slide during our time in presentation, when we were all together, I think there was this sort of look on the left of like, well, no, that's not the desirable form of learning. Now the learning that's on the right is really what's really interesting, and that's what libraries want to support. But in the current environment, I think most of us are shifting, and we're spending more time in front of our laptops, spending more time with distance education or remote materials and content. And that puts that strain on the in-person learning that has to happen. This has been one of those periods where a lot of people have said maybe that digital distraction isn't as bad of a thing when it's the only thing, that perhaps this is what tips the scale and says, well, we could be online forever now and not necessarily have to think in terms of those in-person content. The key questions I think we have to think about are, how will libraries adapt policies and services to better serve students that practice more limited movement on campus? I know that we only had a couple of times opportunities to talk with school librarians, but I think one of the interesting things that's starting to think about is that as we look at coming back, schools coming back for fall of 2020, when they start the next academic year, there may still be restraints on how much movement students get to exercise within the class, within the school campus, that perhaps they will stay in one learning environment and either different instructors will rotate into that room, Or perhaps students will come in shifts so that there's a morning shift of students and an afternoon shift of students, and there won't be as much pressure on the confines of a single classroom. And so how will libraries start to think about, well, how do we get materials to users? How do we integrate that sort of free learning space into a learning environment that's more confined? And maybe even how do we start to accommodate and serve a very hybrid learning environment where a lot of people are learning in person, but then a lot of people are learning online at the same time. And those sort of hybrid demands for online learning and in-person learning, I think are probably going to put additional strain on many of our teams and units. I think we may also see the growth of more digital teams and digital units that are, whereas most of our efforts might currently be focused to the in-person transactions, and maybe we have a smaller cluster of people who are the online services librarians or something like that. I think we're going to start to see either the cross functionality of many of these teams or a shift in human resources to sort of put more people into the online learning space. Because for at least the near future, I think more and more people are going to be balancing their time in person versus and online in more of a 50-50 hybrid rather than the sort of tipped versions that we've known. Right now, we're in very much online. Before this, we were in more on in person. I think now we're probably going to hit a sort of middle ground for a certain way. I want to go with some of the questions. Robin pointed out, that this sort of morning afternoon shift idea is something that has been seen before. Afternoons didn't work out well. Both students and teachers were too tired by that point. So some of the models that are also being spoken of are that maybe some students go to school Monday, Wednesday, others go Tuesday, Thursday, and everyone has a sort of virtual day on Friday. And that might also help start to reintegrate students without putting additional stress on some of the classrooms. So I think that this idea of shifts may work, even if it's not the sort of morning, afternoon, or other type of model that may work. We talked a lot about location and co-location of different services, the intermingling of different services. I think we're going to start to see one of the big challenges around locations is that there's going to be increased focus on hygiene and sanitation of those services. And this may seem kind of silly, but I think from a budget perspective and a safety perspective, this might be something that we need to think about. Will libraries be able to increase or reprioritize budgets to support the level of cleaning and sanitation that will be required in these public spaces? How will we be able to access a regular supply of products and materials to accommodate this level of cleaning and sanitization? And will libraries need to re-examine policies relating to food and drink, restroom use and availability, use of public access computers, use of our public spaces by other organizations or groups, I think might be another interesting question that we'll need to revisit in terms of policies. There might be even though the past several years for libraries have started to look at increased commingling of services and the welcoming in of different groups and organizations to host their meetings and other things. I think this sort of hypervigilance around cleanliness, sanitation, and understanding who's in a given space is going to mean that for many public libraries, they're going to have to rethink who gets to come in, what organizations will we host, how much mixing of different groups and people will we accommodate and allow, especially in the very recent months when we start to come back together again. That's a really big shift, I think, for some of our libraries that have become those sort of community hubs and community centers. And this might be a big challenge for some of our library managers, city managers, other boards and other things to really think about, well, what's our new public meeting policy? What are those types of topics going to change? And then there's a comment, overall budget reductions mean there will be a greater need for shared services and spaces. And I think that's going to be absolutely one of the tensions that we're going to start to see. I think that's why we're going to have to fall back on policy very quickly and ask, well, especially for boards or trustees or something else, how do we manage that increased demand for space against a commitment to hygiene and cleanliness? And then a comment from Robin, another possible trend moving library services out of the library and into the greater community. Absolutely. We're going to start to see some opportunities to maybe do things in more open areas where people can kind of self-distance and other types of things. Some comments about movement. You know, I think many communities, and I know this is different region by region, but many different communities have invested a lot in trying to make it easier for people to move around their communities. These scooters, self-driving shuttles, you know, drones. I know drones were mentioned earlier in the chat window, or even pedestrian-only streets. I think one of the things that we're going to start to see and perhaps question for the elderly, for young people, or for people without cars, buses and other forms of public transportation are kind of key to their navigation of communities and community services like libraries. If public health concerns start to limit people's use of public transportation, will libraries experience a decrease in gate counts? Now, I know that there are states and areas where you have to have a car, but I also think about, well, kids getting on the school bus, that experience of getting on the school bus is going to fundamentally change. Many school districts are already talking about how they're going to use space savers in between kids when they do reopen schools, so that perhaps it's a kid every other seat, so there's going to be more limited capacity. We can think about things like dial-a-ride or senior car services or bus or shuttle services or other types of things. Those may also start to change and start to shift. Well, who can come to the library? Will there be larger group visits from to the library? Probably not, because it'll be increasingly difficult to get large groups to transport together and all come in at once. So that may have some changes and shifts in general programming and other types of ideas that are really going to affect sort of gate counts and other types of things. And then I think this is something that we're already starting to talk about in the chat window, this square footage for fire code will differ with square footage for social distancing in small libraries. So the idea that many of our libraries have shifted toward to be people focused instead of collections focused means that we've given more square footage to sort of very close public interaction with different people. Whether that's a space for lectures and performances, whether it's just the open furniture concepts and other types of things that we have. I think we're going to start to see libraries reconfigure spaces to provide less seating or workspaces in the near term future. How are we going to do that? I think part of it is starting to think ahead and ask, well, what furniture can you quickly move out or rearrange to sort of minimize those opportunities for contact? Another weird question that I keep wrestling with policy-wise, could libraries implement policies to limit the number of occupants in the space? And also, in doing that limitation of the number of people in the space, could they also limit the amount of time people have in space? And that's going to be really weird, I think, for some libraries to think about that policy. We want to think of ourselves as equitable of spaces for equitable access. We know that that vision of equitable access requires different amounts of time and different amounts of access for different people, given their particular means and opportunities. So I think those are going to really start to shift and change. And some libraries, I think, are going to really struggle with, well, how do we, for lack of a better word, police access to the space given increased concerns for services? Julie noted reservation services, and I think that's a really interesting thing. A lot of gyms, even some retailers, high-end retailers, are starting to talk about future policies where they will have reservation systems so that you can reserve access at a given time and be able to come into that, to have your spot in line and make sure that you get to come into the library at a given time. That involves thinking about, well, what is our policy for reserving? What is the actual practice and system by which we will take reservations for access to our services? The other thing is that, you know, will there be lines and queues outside of the door of a library when we first open? And think also in terms of, I go to my grocery store now and they have a line for people to come in. They also have personnel and staff who are monitoring that line to help adhere to social distancing standards. and also to make sure that people understand where they're supposed to get in line and how the process will work. That's a demand on staff time that perhaps we have not yet factored into thinking about what our recovery efforts will be, that we will be deploying some people, not just to provide services and programs, but to provide a certain amount of space management to make sure that people come into these spaces and know how to use them in a regular way. The other sort of weird thing that I think we're starting to think about, many spaces are starting to think about how they will maintain the health of the people who come into those spaces. And so there's discussion about the use of temperature scanners or other health measures to make sure that the people who are coming into the space do not show symptoms of the current coronavirus or COVID-19. This has a lot of implications, I think. This is a barrier to access of spaces. And I think for many of us who hold that idea of free and open access to our spaces, this could be a significant concern about how we're going to work in this space. The other thing from a budgetary perspective, who's going to buy the temperature scanners? How are we going to staff and make sure that there is someone who is doing the temperature scanning at the entry place to our library? And what is the messaging when you have to tell someone, I'm sorry, but you can't come in because this or that? I mean, these are fundamental policy questions, practice questions that have to be taken into account. Evan asks, that feels very Orwellian. Well, we'll talk about some other Orwellian things, I think. I think these are the big questions. This is very difficult for some of us to kind of think through with our normal perspective of values and how we normally operate. Before I leave these slides, there were a couple of things that I think we hadn't talked about in the previous workshops, but that now I'm starting to think about. And I'll go ahead and go to Evan's comment about the Orwellian nature of things. There's going to be a lot of tension, I think, around privacy. Right now, I think we're starting to see a movement towards contact tracing as a means of controlling the spread and exposure of this illness. Contact tracing has normally been the process by which they would find people who are showing symptoms and do a formal interview to understand the different people and places that individual would have had contact with, so that they can better understand the chain of the virus, but also so that they can start to understand and anticipate people who might then start to show evidence of symptoms and notify them ahead of time so that they can get ahead of the full-blown infection. Many governments and technology companies are starting to talk about the option of doing contact tracing based on many of our own personal electronic devices and using things like the Bluetooth or wireless connectivity of our phones to start to map and figure out, well, how can we understand the movements of people so that we know where they might have been, what Wi-Fi networks they may have tethered to, how they had Bluetooth interactions with other people's phones or devices, so that we could understand by electronic trace who they've actually been in contact with. And I think because there is such a significant concern and urgency around the public health nature of this, I think for some organizations and governments, there is a willingness to allow that to challenge our normal notions of privacy. For many innovators and technology companies, they're trying to focus on the anonymized nature of the data. But I think for much of this to work, there still has to be the understanding that not everything we do will continue to be anonymous, and that there will be ways in which we are tracked in different communities to make that happen. For libraries, then, I think that there's a question of, well, how do we as a profession, as an institution, how do we think about that? How do we adhere to our traditional values for privacy while also recognizing the public health urgency of this issue? And that's a policy question that I think we're going to have to address at a large scale, in much the same way that we had to address issues of internet monitoring during the post 9/11 emergency and crisis. So that's going to be a significant challenge for us. I think one of the other things that we're starting to see is that many communities, even once they come back to normal operations or near normal operations, will be focused on issues that perhaps aren't as integrated with what libraries traditionally do, or some communities or community leaders could forget the role that libraries play. There's going to be, of course, a big focus on economic redevelopment, in which libraries, I think, might be well positioned to start to assert how they can have a role in that place. There's also probably going to be an increased focus on preparedness that is going to take up resource dollars at the local, state, and federal level. And frankly, in a constrained budget and an economic situation, thinking about, well, do we have a role to play in that preparedness, or could that preparedness cost some communities the dollars that they would have otherwise spent on libraries, cultural activities, or something else? So trying to think through, well, what's our role in this sort of focus on preparedness? From a people perspective, I think several segments of populations, of course, are becoming increasingly vulnerable given the current situation. Even when we return to near normal services or status, older adults are going to have a very different reality than the rest of what we would normally term young people. Because of possible health vulnerabilities, there is the high likelihood that even as many people are told they can reemerge and engage in normal connections, older adults will be advised not to do that, that their health precarity might prevent them from engaging in regular systems. That's going to be a really weird thing, I think, for many libraries. We have a pretty good track record of services to older adults, but we also know that in many communities, older adult populations make up some of our most regular users in the public library space. That if we don't see them, what does that mean for our community's use? And what does that mean for our community cohesion for older adults? The other topic might be things like people who have been traditionally marginalized. Of course, people who are experiencing poverty, but also people who are experiencing health disparities as a result of their marginalization. In many areas, there is discussion about how Native American communities, African American communities, and Hispanic communities, by nature of the systems that have prevented them from adequate access to healthcare and other societal benefits, that they have demonstrated that they are more vulnerable to this pandemic than other communities. And it has exposed those health disparities. But I think even as we return to normal or near normal services, that we will continue to see the lingering effects of that marginalization and those disparities in those communities. And so we might have, as libraries, an opportunity to think about what our deepest levels of commitment to diversity and to the transformation of people's lives might be. And then I just want to talk about one perhaps internal issue that I think is going to be really, really important. This coronavirus pandemic has demonstrated the absolutely essential nature of frontline staff and frontline workers. And as much as we want to promote the cohesion of many of our staff members, I think that it's also really important to recognize that most organizations operate as a hierarchy. And even in these times of change, we've recognized that certain people's jobs and the nature of their work easily translate into remote and distance work, and the nature of other people's work does not. And so when we return to our workplaces, I think that there's going to be something of a reckoning between how frontline staff are perceived and recognized and compensated now versus how they were before. We've already started to see many retail locations start to incentivize their frontline staff and frontline workers, whether it's with a bonus, with a temporary increase in salary, or something else. But I don't doubt that when we return to our workplaces, there will likely be an underlying conversation that managers, boards, trustees, and other groups need to think about and ask, well, frontline staff are going to be at the front lines of this new normal. And how do we make sure that they are adequately compensated and recognized for the unique nature of their work? And that's going to be another strain on a budget. And we all have kind of recognized that budgets are already going to be strained, but that's going to be another strain on that that really has a human face, that has a human tension to it, and that we aren't going to be able to escape or avoid when we have staff meetings or other types of things. That sort of tension will be there. And so thinking about, well, how are we going, what's the messaging going to be? How are we going to work through that? Might this be an opportunity to recenter and perhaps reevaluate how different people rotate into frontline service versus how they how we have very segmented staff organizational maps and organizational structures? So those are some of the things that I keep thinking about that are a little bit different, that perhaps we didn't even touch on last time, but that I think have new implications and new understandings right now. I wanted to take a little bit of time and make sure that I go back up through some of the comments that you all have provided. I think there's a lot of great questions and other observations in here. Like I said, I think this is a period more for questions than for answers immediately, but it's a way for us to start to organize and think about, well, what are the questions that we'll need immediate addressing when we return into into our workplaces. There was an appreciation for the book bots, and I remember there was some people who weren't as thrilled with the book bots last time. How quickly things change, I guess. The experience of browsing in a store or in a library, I think that's a really interesting idea as well, is that for some people there might be that interest in really returning to a lingering an opportunity to kind of linger through different spaces. And that's, we can understand and appreciate that desire, but how do we deal with that in a sort of public health, a still unique public health and unique and curious public health situations? Oh, I love that idea of mini TV studios or broadcast spaces where people could create their content. We've seen a lot of maker spaces and other types of things invest in sort of green screens and video equipment and other things. We may see increased interest in that because more and more people have become more comfortable with the idea of broadcasting themselves or creating their own content, or even stronger partnerships with public media stations. I think that's another really big thing. I didn't talk about it, but the future of local news, I think, is going to be significantly impacted by this current pandemic and the lingering after effects. Right now, in the moment, most local news stations are seeing wide support because coverage of the local impact of coronavirus is so important right now. The bad thing is that in the economic decline, many of those local community news sources are going to lose huge amounts of advertising dollars. And so we're starting to see some interest in new models for organizing news production, whether that's nonprofit news or other types of systems, community-based news networks, something else. Or maybe it will be a future where it's partnerships with the library or another organization. We're already seeing changes like Overdrive moving into self-publishing. Librarians as media mentors, I think, is such a great idea because I think this focus on production and recognizing good content is still going to become even more important. Oh no, what did I do? My apologies. Okay. The movement of seniors only time at libraries, I think, was something that we were seeing already, and perhaps you know, there were a lot of libraries that had started to think about um, uh, specific open hours for individuals who have cognitive differences or sensory differences, so that perhaps if there were young people with autism that wanted to tour the library when it was less congested, some libraries I know had started to experiment with that idea. but I think also borrowing some of those senior only models that we're starting to see in grocery stores or drugstores during this pandemic could also be something that starts to happen in a lot of libraries. Okay, so I wanted to know if any of you had comments or additional questions to share about some of the trends or changes or predictions that we might be thinking about in the near future. We can do the hand raise and you can unmute yourself to kind of share your thoughts or concerns or areas of question.
Hi, this is Melissa from Fairbanks.
Hi, Melissa.
How are you?
I'm good. How are you doing?
Hope your flight back was good. I hope you stayed safe.
Everything's been good so far. Yeah.
Oh, good. This is really oddly exciting in the way that you sit around before these days and think, will anybody ever adapt to new ways? And I've seen a lot of people just really surprisingly just leap on the bandwagon for some of these things, and that's really interesting. But I wonder also just all these great ideas. And there's no way to answer this, but how much do you commit? Because there's going to be an after. There's going to be an afterwards. There's going to be a time where we don't have to behave this way necessarily. You know, I'm not saying that we'll probably never go back to whatever normal was, but there will be a time where there will be an inoculation and that sort of thing. I'm just kind of throwing that out there. So if you burn down the house, what's it going to look like after that? You know what I mean?
So I think that's a really good thought. That's kind of why I wanted to start with how some of those reports are framing the amount of time or the span of time that we are thinking through. So you are absolutely right that while we have lots of ideas, how much do we want to invest in the transformation of existing policies and procedures for what could be a temporary, although extended temporary period? So right now, many of the reports are pointing to a year to 18 months. So thinking through, well, how would we effectively plan and commit investment to something that will likely only last a year to 18 months? I think the other thing that you might have to ask yourself, especially unique to the system that you're operating in right now, is, well, many of those reports are writ large, looking across the broad diversity of community composition and other things. Alaska, I think, has over 250 cases right now, and a low number of fatalities. So there may be indicators that the impact might have less effect on your specific communities. And so you might not need to make all of these pivots and changes. But some of them may require the revisiting of policies. And I think that's why, more than anything, what I think right now, I think, is a time to think about and perhaps audit policies rather than immediately shifting towards innovations or changes in services. I think that the policies of who comes into the building, what materials, how many materials can be checked out, those types of things. I'm sorry, Julie clarified it's 300 total cases in Alaska. But that may be your best investment to kind of think through, well, what's our current policy manual? And have I highlighted with staff the areas of policy that may need revisiting? And I tried to highlight things like food and drink in the library is probably a policy that many libraries changed 10 to 15 years ago. And perhaps we need to make a slight temporary adjustment in the next, 6 months to what our food and drink policy is. Maybe it's a slight adjustment to the process for reserves, where they are made available, how many reserves can be taken at a time. Maybe there's a shift in, this is going to sound silly, but those libraries that do hot picks or hot titles, where you only get a title for 10 days or something because there's lots of other people in line. Well, we may have a process now that says it goes out for 10 days, it comes back for 3 or 5 days to kind of cool off in the library before it goes back out for another 10 days or something. Those are mostly changes in process and policy rather than sort of the innovations that take investment of money and other types of things. So I think your comment is really helpful in balancing and thinking about, well, how much do we invest in making these changes? Other comments?
I think the point you were just making about the length of time really makes sense. This is Paige, because of the fact that there's just not enough money in library budgets to sort of provide enough technology and enough online and collections and enough of everything in order to completely shift to a complete new world. So I think it makes sense to think about what makes sense now and what doesn't make sense.
Yeah,
So sustainability.
absolutely. And now is probably not the most ideal time to make a significant financial investment. You're really trying to figure out what is the minor adjustment to services that you will need to make for the new normal that will start to shift things. Yeah. So I wanted to, just as kind of closing, many of you will remember I started to talk a little bit about curiosity. And this is usually one of the ways that I start those workshops. And I'm going to throw this back out there because I think it's really important to think about how we approach all of these trends and changes right now in this moment. I don't know that there's too much of the joyous exploration happening right now. I don't know that there's too much of the social curiosity happening right now. I think most of us are probably operating on that position of deprivation sensitivity, recognizing those gaps in knowledge. It's not about finding the answers in the trends, it's about finding the questions. And maybe there's an opportunity for some stress tolerance, that willingness to accept and maybe even try and your best to harness some of the anxiety associated with some of those changes. And as Paige pointed out, as Melissa pointed out, maybe now isn't the time for thrill seeking. Maybe it's not the time to take those financial risks. It's enough just to say, well, we're going to be curious just in so much as we can kind of figure out how to answer some of those blank questions that we have and think together about how we can use this anxiety to think about what might be next, maybe only for the next 6 months or maybe for the next year. So I will leave just that up just to think about and say it's okay not to try and reinvent and create an entirely new world for libraries. Right now, we're doing what is curious and what is valuable just by thinking through how we manage sort of the stress and anxiety that happens in these types of change. I know that I only have 2 minutes left, but if there's any questions or anything else that you all wanted to take up, I'm more than happy to hang out and chat a little bit more. The other thing that I'll just say is that I do think that this follow-up is a little bit unfair because we're going through these changes and stuff. So if there's ever another time, either through Julie or emailing directly to me, I'd be more than happy to revisit once we come back to our new normal and can invest more time in the sort of trend scanning process and other types of things. We wanted to do this follow-up because it helped keep some of that energy from our March discussions. But I know that it's not exactly the most fair use of your time during a very stressful period. So we can always revisit this and talk about how we kind of build groups and coalitions to think about the future together across your organization or across the state. So thank you all so much for your time, and I wish you all good health and safety and everything else. And Martha asked if the session was being recorded to share, and it is being recorded. So I think Julie will be sharing that out.
Right. And so Miguel, if you want to give me back the presenter role, then I'll go ahead and stop
Yes.
recording. Yeah.
Okay.
And Miguel, I may very well take you up on your offer. That's fantastic.
Please do. This isn't the fairest thing. Yeah. Okay. Why can't I figure this out? Oh, I'm sorry.
All right.
Assign. Let's see. Did that work?
Nope. Oh, maybe I just grabbed it. Okay. Okay. I'm going to start sharing. Will end if you become the presenter. Yes. Okay. So I'm going to. Where's the recording? Here it is. Stop the recording. Do you want to stop? Yes.